Hello, my name is Corey Vandiver, and today I'm going to be talking to you about obsessive compulsive disorder, also known as OCD. To have obsessive compulsive disorder, you must first have an obsession. An obsession is categorized by an intrusive thought, or mostly nonsensical thoughts, images, or urges that an individual tries to resist or eliminate. The obsession is then followed by compulsion, which are thoughts or actions used to suppress the obsessions and to provide relief to the individual. When it comes to OCD, there are four major types, and these are broken down into symptom subtypes. These four are symmetry, forbidden thoughts and actions, cleanliness and contamination, and hoarding. These are the four most popular types of OCD, and the first one, symmetry, affects 26.7% of those who are diagnosed with OCD. Those who are obsessed with symmetry are obsessed with having things in perfect order, just the right way they want them and aligned just perfectly. The compulsion for this involves repeating rituals and putting things in order to where they're just right. The second most popular type is forbidden thoughts or actions, and this affects 21% of the population diagnosed with OCD. These forbidden thoughts or actions are usually aggressive, sexual, or religious in nature, and it includes fears and urges to harm oneself or others, and also the fear of offending God. With these obsessions, the compulsions for these include checking, avoidance, and repeated requests for reassurance. The third most popular type or subtype of OCD is cleanliness and contamination. This subtype affects 15.9% of the population and is probably what I think of first whenever I think of someone who suffers from OCD. I think of someone who's constantly washing their hands, re-washing them, cleaning themselves or their area, and the obsession for this is the obsession over germs and the fear of contamination. The compulsions for this subtype include repetitive or excessive washing of oneself or of an area, and also using gloves, mask, or other protective equipment in parts of life that do not necessarily require it. The fourth and last of the most common subtypes of OCD is hoarding. Hoarding is pretty much just the fear of throwing anything away. It affects 15.4% of the population, and the compulsion of this subtype of OCD includes collecting and saving objects or items that have no sentimental or monetary value to you, pretty much useless to you, but you just can't seem to throw them away. An example of this could be keeping old used water bottles and hoarding them in your closet or all over your house or your car, and you really don't know why, but you just can't bring yourself to throw them away. Another symptom that is common in OCD is a tic. A tic is an involuntary reflex or jerk of the body, like a jerk of the arm or the leg, and this is reported to, or 10 to 40% of adolescents have reported experiencing a tic that have been diagnosed with obsessive compulsive disorder at some point during their disorder. All of these symptoms and the protocol for diagnosis of OCD are included in the Diagnostic and Statistics Manual, or DSM-5, and it outlines what you have to have and how long you have to have it before it can be diagnosed as obsessive compulsive disorder. Because it is normal to have occasional intrusive thoughts. If you don't have any intrusive thoughts ever, then that's definitely not normal. When it comes to prevalence, lifetime prevalence ranges from 1.6% to 2.3% in people that have OCD. And when it comes to gender, it's about a 1-to-1 ratio. About the same number of males have it as females. With age of onset ranges from childhood to the mid-30s, but the average age of onset is 19 years old for people with OCD. Although it does peak earlier in males, anywhere from 13 to 15 years old usually, while in females it usually does not peak until your early 20s, anywhere from 20 years old to 24 years old on average. For the course of OCD, once OCD develops, it does tend to be chronic. For the origin of obsessive compulsive disorder, it's based off of generalized psychological and biological vulnerability. OCD could be regulated by brain circuits and have the same generalized biological and psychological precursors as anxiety in general. Early experiences of learning that some thoughts are dangerous and unacceptable because the terrible things they're thinking might happen and would leave them responsible. This mindset in early life creates psychological vulnerability that could lead to more prevalence in developing OCD in the future. There is also the theory of thought-action fusion, and thought-action fusion is equating thoughts with specific actions or activities represented by those thoughts. And this could be caused by attitudes of excessive responsibility and resulting guilt developed during childhood. When it comes to treatment of OCD, there are both medical drug therapy treatments and behavioral therapy treatments. For the drug therapy treatments, the two most common drugs prescribed to people who suffer from obsessive compulsive disorder are clomipramine and other SSRIs, which are selective serotonin reuptake inhibitors. These SSRIs and clomipramine are the most effective drugs that have been tested on patients that have OCD, and they benefit around 60% of the OCD patients. One of the drawbacks to drug-based therapies, though, are the adverse side effects that the drugs have themselves, and also that relapse is very common after patients discontinue use of the drug. Highly structured psychological treatments work somewhat better than drug therapy, but they're not as readily available as getting a prescription for an SSRI or clomipramine. The most effective therapy for treating OCD is exposure and ritual prevention, also known as ERP. During ERP, rituals are actively prevented, and the patient is systematically and gradually exposed to feared thoughts or situations that are based upon their obsessions or their compulsions. Thank you very much. My name is Corey Vanver, and this is my video on obsessive compulsive disorder, more commonly known as OCD.